Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Now let's look at the lipid storage diseases, LSD, that is lipid storage diseases. So under this, the first one is the Tay-Sachs disease. So this Tay-Sachs disease is the enzyme deficiency of the hexosaminidase. So hexosaminidase A, and the lipid accumulating here is the ganglioside. Lipid accumulating is the ganglioside. So the clinical features here is that it presents with the MR, the mental retardation. Next, there is also the blindness and the muscle weakness. Next, we move on to the other disease, that is Sandow's disease. Sandow's disease. So Sandow's disease is due to the deficiency of the hexosaminidase A and B. Hexosaminidase A and B. So the lipid accumulating here, it includes the globoside and the ganglioside. So in the previous one, Tay-Sachs, also there was accumulation of ganglioside. So ganglioside, along with that there is also the globoside. Next, the clinical features here is that it is similar to that of Tay-Sachs disease, and along with that there is hepatosplenomegaly and the skeletal dysplasias. Hepatosplenomegaly plus the skeletal dysplasias. So we saw the Tay-Sachs disease, Sandow's disease, and next disease is going to be the Fabry's disease. So this Fabry's disease is the enzyme deficiency of alpha galactosidase. So alpha galactosidase, the lipid accumulating, it is the globotriacyl ceramide. So it is a globotriacyl ceramide. So here the clinical symptoms is that it includes, there is skin rash, kidney failure. So skin rash, there is also the renal failure. So this is with respect to the Fabry's disease. Next, we move on to the metachromatic leukodystrophy. Metachromatic leukodystrophy. So metachromatic leukodystrophy is the enzyme deficiency is the ASA, that is the aryl sulfatase A. So you have aryl sulfatase A. The lipid accumulating is nothing but the 3-sulfogalactosyl ceramide. 3 accumulated is the 3-sulfogalactosyl ceramide. So in Fabry's disease, it is globotriacyl ceramide. Here it is the 3-sulfogalactosyl ceramide. And here again you have the MR, that is a mental retardation. Next, it also has psychological disturbance in the adults, as well as there can be demyelination. So apart from this, next disease is the Krebs disease or Krabs disease. So here in the Krabs disease, the enzyme deficiency is the beta galactosidase. So beta galactosidase is the disorder, and the lipid accumulating is the galactosyl ceramide. So beta galactosidase, and the enzyme deficient, the lipid accumulating is a galactosyl ceramide. So galactosyl ceramide. So what are the diseases here, the clinical symptoms? So this was the Krebs disease. There is MR, mental retardation, as well as a myelin almost absent. So myelin is almost, it is absent. Next, we move on to the Gaucher's disease. So here in the Gaucher's disease, there is the beta glucosidase is the deficient enzyme. In the Krebs disease with galactosidase, it is a beta glucosidase, and the lipid accumulating is a glucosyl ceramide. So it is glucosyl ceramide, and here there is enlarged liver and spleen, that is a hepatosplenomegaly, and there can also be the erosion of the long bones and the mental retardation in case of infants. Mental retardation in infants, then you have hepatosplenomegaly as well as the erosion of the LB, that is the long bones. Next we move on to the NM disease. NM disease stands for the Niemann-Pick's disease. Niemann-Pick's disease, NMP disease. So this disease, the enzyme deficiency is sphingomyelinase. So sphingomyelinase is a disorder, and the lipid accumulating, as we know, it is the sphingomyelin is the lipid which is accumulated. The clinical features, again, it is enlargement, the hepatosplenomegaly, mental retardation, as well as you see hepatosplenomegaly. Next you have MR, mental retardation, as well as they can be fatal in early age. So this was about the NMP. Next, lastly, we look at the Farber's disease. So Farber's disease is the enzyme deficiency is the ceramide. So enzyme deficiency is the ceramide. So the enzyme deficiency is ceramide, and the lipid accumulating is going to be the, so enzyme deficiency is the ceramidase, and looking at the lipid accumulating, lipid which accumulates, this is going to be the ceramide. And the clinical symptoms is they can be hoarseness, dermatitis, skeletal deformities, mental retardation as well as fatal in early life. So looking at the common things, there is mental retardation, there can be skeletal deformities, there can be hoarseness, and the dermatitis. This is in the Farber's disease. Next, as we saw previously in the Niemann-Pick's disease, it is again the Farber's disease, it can be fatal in infants. So this is about the lysosomal diseases, the lipid diseases, lipid storage diseases. To watch more videos like these and grow daily, subscribe to the Dr. Hub channel.